The withdrawal of blood is one of the most commonplace yet important investigative procedures which a pathologist may have to undertake. While it may be a very simple process, particular patients may be troublesome to deal with, such as small children. This presentation will aim to show the full procedure of the withdrawal of blood, from the preparation to the preservation of the sample. Firstly, let's start with the reason why blood may have to be withdrawn. Usually doctors cannot find an illness from visible symptoms, so a blood sample may have to be used to test for malicious organisms or disease. Some workplaces require their employees to have a yearly checkup for good health. Whatever the reason, at some point in life, all people have had blood taken by a phlebotomist for analysis, either as a newborn in the hospital or otherwise. There are 3 different methods used to collect blood samples, 2 for adults and 1 most commonly used in newborns. These are venipuncture, finger prick, and heel prick. The first of the methods, and usually the most common method, is venipuncture. Venipuncture incorporates the withdrawal of vascular blood from the antecubital region, which is around the crook of the elbow, or the carpal veins, as these are where the veins are closest to the skin and therefore easiest to puncture. This slide shows the more commonly used antecubital region. The collection procedure is as follows. Firstly, the phlebotomist must wash their hands and put gloves on to prevent contamination. Next, a tourniquet is applied around 5 to 10 centimeters above the collection point to increase the arterial blood flow and hence vascular blood in the veins, but block the venous blood flow. This is possible as veins are superficial to the arteries under the dermal layer. This tourniquet must be left on for 1 minute to allow blood to pool in the veins. The site is then coated with alcohol to prevent infection and the vein massaged to the surface of the skin to enable easier insertion. The needle is inserted at a 15 to 30 degree angle, depending on the depth of the vein. The needle should not be moved until a required volume of blood has been drawn. Blood is collected in special vials coated with anticoagulant and are labelled at the end of the procedure. The needle is removed and the tourniquet released in quick succession. The puncture site then needs to be covered with gauze or a band-aid. It must be noted the vein has been punctured and needs to be dressed to prevent microorganisms and bacteria entering the wound and causing infection. Nevertheless, this method allows for the efficient and effective withdrawal of blood. The second and third methods use identical instruments but in 2 different locations, the finger and the heel. They introduce a new mechanism to puncture the skin, a lancet. These are small syringe-like apparatus, which once the top is depressed, causes a small blade to emerge from the bottom and puncture the skin. This causes a small amount of blood to well above the site and this can be collected and investigated. The finger stick method is usually used in adults, when a small amount of blood is needed for analysis, for example, testing blood glucose in diabetics. An important point when performing a finger prick is that the 3rd and 4th fingers of the non-dominant hand are the preferred withdrawal sites. This is because the index finger has thicker skin and the 5th finger has thinner skin, which makes it less desirable to draw blood from these digits as it results in a deeper wound. The lancet is often combined with a glucose detector to provide a quick and easy tool for diabetics. The heel prick method is used instead in newborns, primarily because the wound heals quicker and with less scarring. This method is almost identical, but the newborn's foot must be warmed to 42 degrees Celsius in order to stimulate blood flow. The best location is shown on the slide. The wound must be made across a ridge of the heel print to avoid it welling in a crevice of the point. This allows quick and relatively painless removal of blood from an infant for testing. Although these methods may be very simple and commonplace, they play a crucial role in the lives of many people. Diabetics are one of the most affected people as they have to take regular checks of their blood glucose level, and this involves using the finger prick method. All blood transplants and donations would not be available in such supplies as we have today if not for venipuncture, which allows for larger samples to be taken. Almost all diagnoses begin with the pathologist analysing a blood sample, and they are the prime investigators in the diagnostic process. In short, the ability to take blood from the body plays a large role in the medical industry, and although methods may change, the ones we use today will always be effective.